how do we deal with the psychosocial? Well, that's going to be a lot of education. Calming fears comes to, like, the fear with this is more, they don't know. So the more they can know about it, maybe that fear can start to kind of subside. So if we can give them an expectation on time frame, so think about what we just talked about, like the 2 months of just dealing with the worst part of it. And if they can wait it out, it typically does get better. Most people don't have to go to surgery. Look at all the studies we've looked at, right? So the few do, but most don't. So then we got to go through the healing process. Well, how is this going to heal? Where are you in the healing process? Explain to them, are they in the inflammatory state, acute phase, repair phase 1 versus repair phase 2 or 3, depending on how their symptoms respond and stuff like that to movement and where they are in the time frame. And the management, what our management is intended to accomplish, and that is to facilitate recovery, right? And let them know, what we're going to do is try to help this tissue get through healing. So, and then of course you have just a few that might be towards the end of repair, be centrally sensitized. And I'll just save that for last because it's just an interesting group of people. But we could share the research with them. What is the research on natural history? Most people get better in spontaneous recovery, spontaneous regeneration or regression of the symptoms. The body trying to heal, share that with them. And then, that eases people's fear and anxiety. Yeah, there's hope.
Some hope.
Hope, right? There's no reason not to. And then, of course,
hope that I'm going to get better.
I think that's super important. That is just super important, and it buys you time to try to help them, right?
Yeah.
And then also just letting them know what their other options are. If what we're doing to help it facilitate recovery is, if we need a little help, we can ask the provider for medications. There's medications that can help us out. We got the NSAIDs, we got the oral dose packs. We've got injections, and we can talk about the MDT and the injections and how effective they are. So we'll go back to that in just a second. And then we have surgery, right? So if you put the options on the table, a lot of people really don't want to go to surgery. There's a few that really are all into the surgery, but most people, especially with the spine, don't want to go there. Yeah. So that buys you time too. And that helps them know, what are the other options? Are there any better options? Well, surgery doesn't sound like a better option unless they really need it,